I think it's true when people say there are a lot of diseases right now in Malaysia, like dengue causes almost 100,000 cases in 2019 with more than 100 deaths, but people did not push as hard as current virus or like tuberculosis, which causes hundreds of deaths and thousands of morbidities, but still people don't push to go and screen everyone for TB or to treat everyone with dengue virus or going around doing some more aggressive approach. Therein lies the problem, because one, coronavirus is sensationalized. When it first came out, there was a lot of people sharing, there were a lot of social media, there was a lot of propaganda, and there was a lot of hate crime spread. But that actually came back as a great thing, because the COVID-19 had a lot of media attention, and the way China managed it in the very initial stage, where they cordoned off the entire Wuhan city and they locked it down, and it did very aggressive contact tracing and everything, and other countries was able to emulate by limiting flight services as well as screening from people coming back from overseas and contact tracing and everything. So that in turn actually helped to control this COVID. So what we can learn from this outbreak is, if we actually put a lot of effort into the other existing illnesses, we can actually cut it down. I'm talking about HIV, I'm talking about dengue, I'm talking about tuberculosis, and we can actually cut it down by a lot if we continue to practice all these safety measures, such as cough etiquette, such as self-isolating when you're ill, taking precautions, keeping up with your health and everything. Definitely we can move towards a place where everyone is more conscious about their role in the society in preventing illnesses. For those of you who don't know, herd immunity means in a community where a majority of person have immunity against a certain illness, especially a virus, the chance of that disease spreading in that community becomes very low, or it disappears. For example, like polio or rubella, where we vaccinate all the children in Malaysia, so everyone has immunity against polio, or at least about 90% of them have. So when the virus comes, they cannot co-infect everyone, so the disease eventually dies out or has no effect. So the question here comes because there were people suggesting herd immunity in COVID-19. However, since there is no vaccine yet available for COVID-19, herd immunity via vaccine is not something to be discussed. So what they brought out was, since majority of the people who will get COVID-19 would be younger people, and they have stronger immunity and have very low side effects, and low death rates, so can they infect the entire population with the hopes that everyone develop an immunity so that you can end COVID immediately? But that is not a reality, because when you infect everyone with COVID-19, people still get symptoms, which are fever, cough, lung problems, and also death, as well as there's no health facility to maintain or to monitor such a large population. So for a population of 10 million, you will need to at least successfully infect 8 million people with the COVID-19, and with a death rate of about 3%, 8 million, blah, 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 blah. I don't know, maybe 24,000 people will die. So that is not a rational choice or something for herd immunity right now. Perhaps in the future, when they develop a vaccine, and herd immunity for coronavirus or COVID-19 can be something that be further discussed in the future. Does 25 to 27 degrees Celsius kills the virus? The answer is no, it doesn't. And also because this virus needs a host, and the host being humans, us, our core temperature is around 37 degrees Celsius. So there's no way we can bring our core temperature anywhere close to 25 to 27 degrees Celsius. So this theory or this rumor is not true. So someone asked whether how many times can you get the COVID-19? You can only get the COVID-19 once because it is a specific type. But once you get the COVID-19, you get immunity against the virus, but it doesn't protect you against the other types of coronavirus such as the MERS or SARS. And at the same time, it also doesn't protect you against the potential mutated new COVID-19, which, you know, if the disease is stay long enough in the community and there's a lot of people infected with it, there's a chance the virus can mutate to a new version that can infect the human again. But so far we haven't seen any evidence of that, so the short answer is once. Well, I personally think a lot of people in Malaysia are still in denial regarding the severity of the condition here. We recorded like a really high number, 190 in one day, which is more than a lot of other Southeast Asian countries has recorded in the entire season, and yet we still take it very lightly. The effect of what's going to happen if we continue to allow people to gather in huge numbers is contact tracing by the Ministry of Health is going to be very difficult, as well as try to contain the disease when there are thousands and thousands of people with possible COVID-19 roaming around the streets, you know, being in denial and ignorant to what they're supposed to do. It's going to pose a big threat to our country and our healthcare system. Because what we can learn from other countries who has gotten hit earlier than us is many of them, like Italy and the European countries, are regretting that they did not take a more aggressive approach when they had the chance. And looking back, right now our condition is much worse than when they actually started to put things into perspective and take things seriously. You have to understand that we have very limited healthcare services to manage this kind of illness. So if an outbreak of 15,000 or 20, 30,000, our country cannot bear that burden on the healthcare system, and it is going to collapse, and it's going to be a very bad time for all of us. So the time to act is now. The last advice that I can give to everyone is the same things, which is 1, to stay healthy, 2, to avoid crowds, 3, to have very good cough or sneezing etiquette, and 4, don't panic, think straight, make smart decisions, as well as, you know, take care of the friends and your family. Don't share things that is not true. Don't go spread a lot of fake rumors and panic, and just take care. We'll see you soon.